West Nile virus is the leading cause of mosquito-borne disease in the continental United States. It can lead to a wide range of clinical symptoms, from asymptomatic disease to severe meningitis, encephalitis, and acute flaccid paralysis. As of 2022, there are no vaccines to prevent or medications to definitively treat the infection. West Nile virus is an arbovirus, which means it's spread to people from infected arthropods like insects and mosquitoes. It's from the Flaccid family, which are positive strand RNA viruses which mainly infect mammals and birds. Other diseases caused by this family of viruses include dengue fever, Japanese encephalitis, yellow fever, and Zika virus. After being bitten, the virus replicates in dendritic cells and then spread to lymph nodes and through the circulation to other organ systems, notably the CNS. Although originally only transmitted among wild birds by mosquitoes in Africa, it was introduced to New York City via diseased birds in 1999 and has since spread to all parts of the continent. Most infections are asymptomatic, however, about 20 people develop a self-limiting influenza-like illness. This is called West Nile fever. Common features include sudden onset of fever, myalgia, arthralgia, and pharyngitis. Importantly, a rash is seen in about 50% of people with West Nile fever. The rash is typically found on the chest, back, and arms, and is maculopapular, and sometimes it can be itchy. Interestingly, the rash is associated with a decreased risk of neuroinvasive disease and death. Neuroinvasive disease is rare, but more likely with advancing age, females, and those with malignancies. It occurs in the form of meningitis, encephalitis, and flaccid paralysis. The mortality rate of patients with neuroinvasive disease is approximately 10%. West Nile virus meningitis presents like other forms of meningitis with headache, meningeal signs, and photophobia. Its encephalitis, interestingly, commonly presents with extrapyramidal symptoms, including Parkinsonian features like tremor, rigidity, and bradykinesia. It can also cause an acute asymmetrical flaccid paralysis syndrome due to anterior horn cell poliomyelitis. If there is concern that there is neurological involvement, serology for West Nile virus specific IgM antibodies must be obtained from the cerebrospinal fluid. PCR testing can also be performed. MRIs can sometimes find abnormalities in the CNS, although they might not appear for several weeks after the onset of illness. Even in serious disease, management is strictly supportive in the form of IV fluids, respiratory support, and seizure management. So, what do you actually need to remember? Well, I think it's really good to know that West Nile virus can give you flu-like symptoms, and the rash is actually protective for neuroinvasion. This comes in the form of meningitis, encephalitis with features of Parkinsonism, and acute flaccid paralysis. I just remember a rhyme I made up, which is, a snuffle might make you ache and shuffle, but a rash will help you move more like the Flash. This makes me remember that you can get flu-like symptoms. The ache reminds me you can get meningitis and neck rigidity, and the shuffle makes me remember that you can get encephalitis, which causes Parkinsonism. The second line makes me remember that the rash is actually more likely to be protective from things like acute flaccid paralysis. Don't forget to like, comment, and subscribe. Please hit the notification bell, it really helps out the channel.